Hello there, my name is Noni Frances Ariahu. I'm a family nurse practitioner and I'm going to be conducting your exam today. Okay, I see you're here for a physical exam. Is that right? And I'll confirm that with my patient. So before my exam, I would have carried out, checked my vital signs by checking my patient's blood pressure, heart rate, um, respiration temperature, and oxygen saturation. And in this patient's case, all are within normal limits. So I'm going to check my patient's mentation by asking my patient his name and birthday. Also verifying that with the patient on the patient's bracelet. I could ask the patient where, if the patient can tell me where he is. I could ask the patient what is the patient's what is the patient's what month it is, what year it is, with what the name of the president, just to make sure the patient is alert and oriented, times 4. And in this case, my patient is alert and oriented. I could also ask my patient for allergies, if the patient has any known drug allergies. Okay, and I also ask the pain, if the patient is in pain, on a scale of 0 to 10, if the patient could rate his or her pain, and then I'll keep that to note, and also find out the location, and all that where the patient is having the pain. Okay, so, and also in this case, I would also look at my patient's complete appearance. My patient's sitting position, the posture, is the patient symmetrical? Look at the patient's facial features. Look at the patient's skin. Make sure the patient's skin is even. Make sure patient's age is appropriate. Facial features are symmetrical. Okay. And then I can look at the patient's head. Look at my patient's head. Look at the hair. Look at the hair distribution. Make sure patient doesn't have any lesions, any infestations, any bumps, any lumps, any indentations from surgery, any kind of like depressions too of the scalp or anything, any form of incisions, any form of rash or anything. Yeah, make sure patient doesn't have any form of like abnormal hair loss or anything going on. Okay, so, and then after that, in my patient's case, everything seems within normal limit. So I'm gonna go to my patient's eyes. I would ask my patient if the patient uses glasses, and my patient tells me no. Okay, so look at the patient's eyes. You can see my patient's eyes are normal, the pupils are dilated. So I can test for visual acuity and also check for peripheral vision as well. In this case, since we don't have the lens test in this case, I could just test my patient's eyes. Okay, we just check for the patient's we check for constriction of both eyes. Okay, in this case, I'm going to turn the light off and ask the patient to look forward, maybe look straight at an object. Just going to turn the light on. And patient's eyes were able to constrict from 3 centimeters to 2 centimeters. Okay, and I'm just going to check for the patient's vision. I'm using the cardinal points. Okay. All right, I'm just going to have you look at my pen. Okay, just follow this. Just follow my touchlight. Okay. Okay. All right, so that's good. So I'm also going to look at my patient's eyes. I can look at my patient's conjunctiva and make sure it's pinkish. So it looks pinkish. I look at my patient's sclera as well to make sure the patient's sclera is white. So, and with all this assessment, I see my patient's pupils are equal, round, and reactive to light and accommodation. Okay, and while I was checking my patient's eyes, I didn't notice any hemorrhages or exudates. Okay, all right, so, and we also see my patient's eyebrows are symmetrical as well. So next I'm going to go to my patient's ears. Okay, I'm going to ask my patient if my patient has any trouble hearing, or has had any procedures done to his ears, or has had any trouble he has any trouble hearing or anything. So I'm going to flash my torchlight into my patient's ears just to check for any swelling or exudates in both ears.